just to revise it, that what are disruptive behavioral disorders are that the child has difficulty in two elements: emotional regulation and behavioral regulation. So they will not be able to regulate this emotions as well as problematic behaviors. That will lead them into problems. Now, the consequences could be that one, conflict with authority figure, and other, a severe one is violation of rights of others and breaking rules and regulations. And this is not merely the societal rules, but also the rules of judiciary, legal rules, all those things. So any problem in these two regulations would lead to these kind of consequences. Now, if it is limited to this, it is oppositional defiant disorder. But when it leads to extent of this, that it is causing problem for others also, in the sense others' rights are being disrupted, it is conduct disorder. So this is just a brief explanation. Let us start with oppositional defiant disorder. How it is defined is persistent. They say that 6 months, but again, we say that clinically, if the severity is much, causing significant problems, we can still diagnose it in lesser period. Negativistic, disobedient, hostile behavior, mostly towards authority figures. So disobedient and hostility, they do not take responsibility for mistakes. मैंने नहीं किया, भैया ने किया, blames others. So these are the basic criteria of oppositional defiant disorder, that they'll be very disobedient towards authority figures. मैं नहीं करूँगा. Or they'll be very angry. They'll be very blaming towards others. इसने किया है, मैंने नहीं किया, इसकी वजह से हुआ है, मेरी वजह से नहीं हुआ है. When you ask them to do something, either they'll not do anything or they'll retaliate, or at the most they can also get vindictive. So negativistic attitude mostly towards authority, not taking responsibility, blaming. Epidemiology is 6 to 16%, but important thing is that it reduces and the equality between male female increases as the adolescent period comes. Types and clinical features, you have to remember 3 things. One is angry irritable, argumentative defiant, and vindictive. Just remember 1-2 words regarding that so you'll understand. For angry irritable, the child will be self-annoyed. And if they've been asked to do something, they'll not retaliate or they'll not respond with verbal abuses or like that, they'll just not do it. Right? The other is argumentative defiant, whether they get where they get into altercations. Now this may happen with peers also. They may start using abusive words. Right? And vindictive, basically, they will be revenge taking. So this is the severest, or rather severe, severe form of the one of the types of the oppositional defiant disorder. Now, it has to be present in at least one individual who is not a sibling. This is very important because otherwise it could happen that it is confined to only home. Though it can be made in one setting, but it has to go beyond one sibling. And this is important. Diagnosis of disruptive mood dysregulation disorder is not met. We'll see the differentiating point in the differential diagnosis. So comorbidities, as per the DSM-5 and now also ICD-11 now, conduct disorder can be one of the comorbidity. ADHD, obviously depression. These are the common comorbidities with oppositional defiant disorder. Differential diagnosis, we have to differentiate it from the normal development. 3 elements you have to remember. 1, during the toddlerhood, or as they called as terrible 2s. So 1.5 to 2 years of age, that part there is normal defiance because they are in a phase where they have started exploring things. Other is when it comes to separation anxiety. When the separation anxiety starts, it generally starts at around 10-18 months, but when it is leading to, for example, school going, the starting period, in kindergarten or nursery. So initially, because of this separation anxiety, they'll be in distress, and few days they may defy going to school or other instructions. But again, over a period, if it is things are fine and there's normal attachment and proper support, it will subside. And the other is adolescence, whether there will be some defiance as a part of autonomy. So you have to remember that these are the normal phases which last for a brief period of time. We are not supposed to tag them as oppositional defiant disorder. Now, conduct disorder, we have discussed that it basically leads to violation of rights of others as well as breaking rules and regulations, right, regarding conduct disorder. So it's basically violation of rights of others and rules and regulations are broken. This is the differentiating point between ODD and CD. Disruptive mood dysregulation disorder, there will be chronic irritability. And in between, they will have certain significant increased periods of irritability and anger, but they won't be as a part of defiance to an instruction being given or a discussion being done. ADHD, yes, the defiance can be part of impulsivity of ADHD, but then you have to rule out the other symptoms also. Adjustment disorder, temporally associated with stress, lasting for a brief period once the stress is removed. And ID associated behavioral problems or defiance, you have to understand whether they are task avoidance defiance or whether they are demanding something that the parents are not able to understand, those kind of defiance. The course and prognosis, if you see, 25% of ODD, they remit completely, 25 to 30%. 30% of ODD go on be conduct disorder. But vice versa, if you see persons having conduct disorder right now, they would be having significant ODD in the past, but 30% clearly progresses from ODD to CD. And also, it depends on various other factors, that is age of onset. Earlier, it is more basically problematic and persistent. If symptom severity is there, specifically very high severe symptoms lasting long, then they may be persistent. Presence of comorbidities, as a case in every other disorder, the presence of comorbidities will lead to poor prognosis. Type of ODD here, the first one, that was angry irritable. So these and these two, they have showed a bit of different trajectories. So angry and irritable, they mostly progress to depression, while the rest two, they progress to conduct disorder. So this is the course and prognosis, the percentage and the factors determining. Treatment, predominantly psychosocial, because medications are not there for specific management. Medications are only for symptomatic reductions or associated comorbidities. So at least overall improvement can be there in reduction in behavioral symptoms. Psychosocial part, it's parent management training, Incredible Years, program developed by Kasdan, and problem solving. This is done with older children or adolescents. So we teach them to pick up a better alternative to face a problem rather than a defiant or a hostile behavior. Right? So this was about oppositional defiant disorder.